Thanks so much for having us here. My partner in crime at the project is Rita Van Mile, and unfortunately she couldn't come today, but she sends her best, and we were excited to be invited. I was excited to just come to the event, and now I'm on the panel, so here we are. If you could switch to the next one. So the project basically started, we needed to review what mental health services were being offered through LHSC here in London. It became very apparent that there were some very noticeable gaps in services that were being provided. And so we ended up getting funding through the Royal Bank for this project. And so right now we're going through a process of reviewing our current services and doing some research pieces to lead towards that pilot project of what we should be making that change into. So at present, we've conducted some qualitative interviews with staff from mostly Victoria Hospital, but also the emergency department in University Hospital. And so out of that qualitative interview process, we have a very, very deep breadth of information that came out of that, which is great, also a little overwhelming at times. But I decided to bring 3 of those themes that are emerging from that data to share with you today. So the first is that mental health stigma and confidentiality. And so looking at how people perceive the access of services, what that looks like compared to what maybe they're used to from where they've come from. And maybe their understanding of what mental health is, and is it something that you treat, or how does that treatment look for you from where you're coming from compared to the typical treatment process that is being offered currently here at the hospital. Also sort of making sure that people have an understanding around confidentiality, and that's very strongly implemented for our healthcare services here, which they may not be used to and where they're coming from, and wanting to make sure that people know that it's a safe place to talk, that because they say something in that context does not mean that it will go back to their community, and it does not kind of out them in their experience of their mental health well-being. Sorry, and in the little quotes are some actual direct quotes from those interviews that we've conducted. The second theme that I thought was fairly applicable for today was the service access challenges. And so what we hear over and over again is navigating the services that are out there, knowing what is there, where do I go to get that, when is a good time to access service A instead of service B, and making sure that unfortunately, due to resources, there's wait times and there's things like that, but making sure that people understand that that doesn't decrease their perceived need for that service. And I guess making sure that the service providers, both at the hospital as well as in the community, are aware of what's going on and are aware of who is best fit for that service. And making sure that we have sort of a smooth process so that people don't get to the wrong door. You know, wherever you go for service, you will end up finding what you need. And then third, and I think most importantly, is the need for culturally relevant care. And so at LHSC, that is a huge gap right now. We basically have one level of care that is being provided. Obviously, there are definitely people that are providing care in the different areas of mental health that have a personal interest in trying to apply care in a culturally relevant way, but it maybe isn't supported by the infrastructure or, you know, timing of care, diversity of staff, diversity of languages that service is provided in, especially treatment groups. Those are all English language at this point. And so we really want to kind of look at this proposal of a project and make sure that the treatment is specialized, especially for traumatic care. specifically for refugee clients that would be accessing services, we do have care for trauma at the hospital, but it's not specialized in the sense where it would be victims of torture or people who have really seen war-based crime or the extent of violence that they've experienced. So making sure that service providers are ready for that and are aware of the best process to provide that care. Again, multilingual service provisions so that although we currently are able to provide translators, it would be really nice to have service provision in a language that the client is wanting to access that. And that sort of takes that third party out of the picture to make it a much clearer understanding if that's a possibility. Obviously, we won't be able to staff in every language, and so making sure that translators do have some additional training in that sort of trauma, mental health sort of aspect, which Seeds of Change we're working in partnership with around that. But also making sure that we're utilizing the resources that are out in the community so that we're not duplicating case management, but we're using case management services that are there while being able to provide a specialized mental health service when it's needed. So when somebody is experiencing a mental health concern in a moderate to severe level, that there is a specialized service that can come in, provide care, provide some recommendations for that ongoing case management, and then when that person becomes stable, is become more comfortable with day-to-day life, we can then as a consultation service take a step back and have that sort of case management at the community level maintained, obviously being available to come back in when needed, if needed. So that's my 5-minute sprint. Thank you very much for having me. My email was up on the screen. Please feel free to come up and grab a card from me if you want.